about
My
this?
2 boys.
Yeah.
Yeah. They weren't supposed to be here. But they still a blessing to me. Now they 20. My babies are 26 and 25.
So did they tell you couldn't get pregnant or?
Yeah, they told me that, and they used to scare me because as I got bigger, and I would be so traumatized, thinking I'm going to die trying to have a kid. You know, they used to tell me. At least my mama, I don't know what they was telling her, but she sure was scaring me. And but then I turned around and I said, God is good, because I was able to have at least 2. Now for health reasons, I turned around and tied my tubes and everything, so I won't bring any other child like that or jeopardize my health or my life.
You got advice for mothers of kids with sickle cell or women with sickle cell considering having kids that they can?
Yeah, that's it. And stay up on a doctor. Anything go wrong, call that doctor so they can catch it like that.
Okay.
Because some people just don't know it ain't nothing, and then next thing you know, something happened that might be the main thing that take away your life. So stay on a doctor as well.
So mother, but you can't have sickle cell if you're a lady with sickle cell. You can definitely get pregnant. It's not unhealthy. How old are your 2 kids now? What's the names then?
Jeremy. This one is my baby boy, and this is my oldest one. He's the one that's 26, and this one is 25.
Okay. What are the names then, Jeremy?
This is Jeremy, and this is Christopher. He's the oldest, Christopher Gardner, and Jeremy Gardner. And now they got, like you said, the traits and stuff. My 2 grandbabies, they got traits. We keep up with stuff like that now. Because now, a lot of times when they first born, they test them for sickle cell. I don't like to look up. I need to too far.
Alright, just first I just want you to say your name, and then my name is Theresa Blanket. I have sickle cell.
Okay. My name is Theresa Gardner. I'm from Prattville, Alabama, and I have sickle cell.
Okay. What is sickle cell?
Well, it's when your regular sickle cell is round, and it goes throughout your body, and then the sickle cell is made like a little sickle, and so it made like certain oxygen. It takes more oxygen to work on that sickle than it does a regular one, and that's what causes the crisis.
Okay. Could you tell me the story of first sickle cell crisis you remember?
I remember when I was a little girl, I might have been 5 or 6 years old, and I remember hurting real bad, and I didn't know what was the cause of it. You know, I would wake up sometimes with hurting, and my mom would come in, and then next thing we know, she'll give me stuff to drink and stuff, and then see whether or not then I would start getting fevers and things like that, and she would have to take me to the doctor. And I was in Buffalo, New York at that particular time.
So what do you think is the hardest part of having sickle cell?
Treating it. And when I was younger, there was a lot of certain things I wasn't able to do that regular kids do. I wouldn't go out there and stay out long periods of time playing sometimes, or out in the sun. And I used to, as I got older, I started learning how to stop a lot of my crises. I used to go swimming. If I went swimming and stayed swimming too long, I'd go into a crisis. Every sickle cell crisis is different in different people.
So what type of medication do you take to prevent a crisis?
Well, I try to keep my immune system real strong. I used to take iron pills. I don't take them anymore to build up the cells. Right now they have me under this medicine they call hydroxyurea, and it makes my skin feel a little different in time as you start taking it a lot for long periods of time. My nails on my feet, they turn dark from the medicine from the hydroxyurea. And they test me every time I go to the doctor to make sure the hydroxyurea is building up to a certain point to stop me from having crisis. Sometimes I started at first taking it like 3 times a day. Then, when I go back to the doctor, they'll look at my point, and then they'll say, well, break it down to 2 times a day. It had to have a certain level so it won't function if it gets to a certain level on the hydroxyurea. So like every time I go, they have to test it and see how far I am on the level of the hydroxyurea.
So is the hydroxyurea working for you now? Did you finally get it?
Well, it's slowly doing it, because as long as I do certain other things with it, it helps to stop the crisis.
Okay. What is it like dating wise? Does it change your dating life, or is
Not really, unless I'm in pain. Not really. I live a normal life on that level as far as date, but I have to know when the person, if we're having sex or anything like that, we have to know, because they always tell us about the children of sickle cell people. You gotta know what do your mate, they have a trait, or do they don't have, or they're normal, or they have the sickle cell. Because see, having it together will make the child real sick, or the average trait sickle cell, or the real blown sickle cell. And I have the full blown, because my mama and my dad both had the trait. My mom we have our 3 kids, and I think my sister has a trait, but each trait does differently in each individual.
okay?
Mm-hmm.
So is sex different for you with sickle cell, or is that?
No.
That's not.
But my mom used to threaten me a lot. Be careful at your sex life, like the average person, because you don't want to bring a child in there sick and suffering. So you have to, just like I said earlier, you have to worry about what type of person is it sickle cell or normal or whatever. So you know if you ever get in a crisis where you're pregnant, you know how your child gonna be. You try to prevent that.
The worst or the weirdest place you ever had a crisis?
At the swimming pool, YMCA, years ago.
Okay.
I learned on my sickle cell. I stayed in that. I think it's the chlorine they have in the water, and if I stand in long periods of time, like later on that night or so, or in the morning, I'm hurting and it's causing a crisis. So I learned to limit my time in swimming pool water and stuff like that, so it slows down my crisis.
So pregnancy, you think harder for a woman with sickle cell, or about the same?
Not the same, but you gotta, you know what you can withstand. They tell us to keep from being dehydrated. They tell us to keep walking, because like if my legs are hurting, it's hard for me to do a lot of the stretching. They want us to do the stretching so it can start the pain, but when you're hurting, you can't do all that stuff, but you do what you can do. And they said try to make it better, but to me it doesn't. So I had to pop a pill or something,
So how many kids do you have, Dirty?
I only have 2. 2 boys.
Do they have sickle cell, or?
They just got the trait.
Both of them?
But they don't have no signs and stuff. Maybe, but they don't get sick or nothing like that like I do. So they have to watch me most of the time, because I have the full blown.
Oh. So you said earlier the doctor told you couldn't have kids.
They told my mother that, and my mom used to, as I was growing up, like when you're in your teen years, you're trying to find your little boyfriend, and my mom used to threaten me, it's gonna, you're gonna die, but some people, they can't. Because I know about 1 or 2 people that have died trying to have kids. But I was blessed to have 2, because they had them back to back. But I never could carry them fully, like a full 9 months. I would probably go to the 8th month, and then my blood pressure will go crazy, or that's when they start putting me in the hospital to make sure that the baby is safe and everything like that. And I had to do a C-section on both kids.
So you think it was because of the sickle cell that you couldn't carry the 9 months? You said that
yes.
the other 2 women who died, do you think it was because they were pregnant with sickle cell or just
What?
pregnancy issues in general?
It might have been because for me, instead of trying to make me have it, that's when they decided, oh, we just gonna go ahead because the sickle cell will cause different things when during your term with the child, you know. So some people can't get to a certain point and then it destroys them. They like the 2 people that I didn't know, they died. One died trying to have it, you know. You get your body to a certain point. That's what made them decide, well, we just gonna go ahead and do this before you get to that level. For causing you to die. They said, oh, we just gonna go in there and give us C-section, and that's what they did on both of my kids.
Okay. So both of your boys have the trait. Do they
don't
have symptoms or
no?
Just normal?
They just live a normal life. Cause they daddy, they father didn't have sickle cell trait, nothing. They were just normal people. And the trait came from me because I was full blown. When you mix them 2 together, then if you have 2 that have traits, boom, then you have some that have a trait and some, there's one going to come up in there that they're going to say it's going to be full blown because there are 2 traits.
Mm-hmm.
Yeah.
Okay, so that's what 2 traits equals sickle cell. And
you'll have 2 traits. It depends on how many kids you're having because one might have a trait there and one might be normal. You know,
right?
But at the same time, because but 1 out of those 3 kids you have, one of them gonna end up having that sickle cell full blown, and that's what happened with my mother.
Okay, so would you date or encourage 2 people to date? 2 people have the trait there.
No, I don't really
would you encourage them to have kids?
No, because you have to go through the drama of them hurting. You gotta be, you can look at all the time where people have handicapped kids and your life changes from there, and it's just like that, and you can't help your child if she's hurting. Or only thing you can do is sit there and kind of comfort her, and it's up to the doctor to do the rest. That's all you can do. And every time you look up, you're trying to comfort her. You want to go through life doing that. If you can help the situation, the best thing to do is make sure you know who your mate is when you have full-blown sickle cell or the trait. Now, do they know? Go find out, go get tested to see whether you got your trait or you're normal. Some people don't make that effort,
So do they have a hard time finding your veins or?
No, not me.
Yeah. You ever received a blood transfusion?
When I was younger, because I kept getting sick, and they got to the point where when I was a baby, I had transfusion.
Okay. Last time you were admitted to the hospital?
For the sickle cell, just being admitted.
For sickle cell.
Shoot, I was younger.
Right.
I might have stayed a day or something like that, because they'll sit there and try to get my body to separate. Then a lot of times they just let you go. If you still don't get to a certain level, then they say, we're going to keep you a couple of days and keep watching. If you get to that certain temperature or whatever they be watching for, then they tell you to go home. But the last time I went there, I just went to the emergency and they gave me some pills and put an IV and started putting some stuff in my IV, and then after about 2-3 hours or so, they say, well, you can go home, they talk to my doctor and everything, stuff like that. And I never had to stay here in Prattville no long. I believe no longer than a week since I've been in this climate.
Mm-hmm.
But as we started going to sickle cell places, and they would take us to Mobile. I've been to Dothan, Birmingham, different places where they have workshops where you learn more and more. If a person has it, it's best to be educated so they know how and what, and try to prevent crisis. And that's what I've been doing, and it's been doing pretty good for me thus far. I'm almost 50. I'll be 50 in November 27, 65.
You'll be 50.
Yes.
And
it's a blessing to still be here and to see my kids, everything like that.
Because that's not the normal. What's the normal age life expectancy for a person with sickle cell? Is it 50
Well,
now,
they
or is
never
it
have
just...
told me. It depends. Like I said, they never told me to that point what it would be. They used to tell me all the time, you get a certain age, maybe 20 to 30, up in that age range. They used to tell me stuff like that, but I'm blessed. I'm finna be 50. And like my boys, my mom used to be so scared of me, especially when I had my first son. She was so scared, you know. And I had a very good doctor. His name was Dr. Johnson, and he even treated my kids, you know. So I'm blessed still to be here and have sickle cell.
So are these workshops still active? They don't do as much anymore?
They don't do as much as they used to.
What about the sickle cell camp? You ever heard of that? You ever been there?
I never been to the camp. I was in a camp one time up there in Buffalo when I was a little girl, but as I got down here, at certain ages they would tell they don't have, yeah, and I never would be up on that because I was practically grown. I was like, when I got here, I was like 17 when I came, because I came from Buffalo. For health reasons, because of the sickle cell, I came to Alabama because the climate in Buffalo needed us for the snow. Mm-hmm. And the climate was a whole lot different than here, and it caused more pain and crisis up there than it do here. It barely snows here. Up there, it snowed like, now you look up there now, snow go up to your face. And I was a little girl living in that climate. It was hard. I was like living in the hospital like it was a hotel room. Stay there a long period too, and they have a room every time because they know sooner or later I'll be back. Because my mom thought I was going to die down there. That's why we came up here. And when the climate started changing, I got back with the sickle cell people. And like I said, as I started growing, I started learning how to take care of myself.
So the climate can affect sickle cell?
Yes, definitely. I might not have been here today if I still was up there in Buffalo, New York. No. I don't believe it. I don't believe how rough and fast up there. I don't believe my kids would have made it up there, because down here it's not as fast as up there. They have gangs and everything else. It's extra fast.
How is fever? You ever had a fever over 100?
When I was younger. Whenever I get a fever or something, or I'm feeling real bad, I take a pain pill and drink a lot of fluids like oranges, joint juice and stuff, and ginger ale and Sprite. Keep your body so you won't be dehydrated, because you know, your gums go to swelling and stuff like that when it start. Sickle cell stuff, and I know something's going with me, and then my legs, if it go too long, or I don't, you know, jump on it when it first start, if it be for a certain period, it starts spreading to one to the other. If it start this tomorrow and I don't been on really jumped in there and start treating it like I'm supposed to, or taking iron pills to build it up, different things they tell us to do. Shoot, it'll spread to this one, and then, or it'll start spreading to this, and I mean, and that kind of pain.
When they ask you to describe your pain on a scale of 1 to 10 and sharp, how does it? What does it feel like those who don't? Can you describe it? Describe a sickle cell crisis pain. What is it?
It's constant. It's somewhat like the arthritis. They say about the arthritis, but mine's throb. It just throb. It starts slow, but then as it keep on throbbing, it'll make my leg real weak. And or it'll swap to this one and start hurting, and then it'll make this one weak where I can't hardly walk on them, or I couldn't even, if it's in my arms and stuff, I can't even hold a fork or a pencil. Because it's shaking like this, because it's hurting at the same time and throbbing. It hurts. And if I can prevent being hurt, because I don't like to hurt.
So, common misconceptions, what do people not understand? What do they say to you about sickle cell? What advice would you like to give people?
Well, the most good advice I can give them is get education on it, so it won't happen to the next person, you know, or just like your sex. You know, get your education so you know you don't want to bring somebody in here doing what you're doing, and as much as you're hurting and suffering, you don't want nobody else to do it. So education really is the key to everything. Okay. For a sickle cell.
You know,
some people don't even they just, somebody talk to you, but you keep on. When you're doing this and you try to not have a crisis, they tell you, when they educate you, they tell you these things. If you don't do it, you know that's what's going to happen, you know, so you try to prevent those things, you know.
Okay. When you say weirdest place you ever had an IV in like your foot or neck and some other weird place other than you?
When they try to put them up in this area up here sometimes, like when I was younger, I know once or twice they tried this or up in here and it hurts.
Yeah.
Because you got to get through some type of plate or something. It hurts when they try when instead of doing it here. I used to have a lot of little holes over here when they stuff like that when I was younger. But if it get to the point where you can't find a vein, they can put a port in your skin. They can do that. I'll call back. My cousin back there. He don't answer, and I ain't gonna worry about it. We got to answer some shit.
It's cool. They said stop ringing the lights. Alright, we ain't gotta worry about it. That's the end of the questions though. Let me see what I think that's the end. Do you know anyone that's ever died from a mental crisis?
About 2 or 3. Here in Prattville. One was in Montgomery. The girl lived here in Prattville and she moved over there to Montgomery. She was born. We used to go to the sickle cell places. They used to have Christmas programs, and we went to the golf thing. They had a big tournament, and then they gave us rooms because we were sickle cell. Different people, they set it up for us, and like I said, that's when they had people come and speak. Doctors from Birmingham, different places. They come and talk about it. They people that treat it, and that's where, like I said, they tell you these things, and if you don't go by what, you're going to continue to have the crisis and you might not live as long.
Okay. These programs, they still exist, or how can people
find
them?
Some of them. Well, the lady that I know that's named Monica, and she's at the sickle cell place. A lot of times, she'll make these things and then she'll send them in the mail for us and say we decide whether or not we want to go to them. And then they have the radiothons. They tell us we have those different things and stuff like that. They always send us stuff in the mail about things. And you decide where you want to go or not.
Okay.
But they're fun when you're dealing with people that's on your level. When you're hurting, you might want to talk to somebody. This here does happen. What do you do for it? You know, you can talk to people. Like I said, education is the key. And if you don't talk to nobody, how you gonna know if they don't tell you? You might do it, and then it might make you better and stop you from having as much. You ain't gonna never, unless you die. That's the end of sickle cell. It's never going. It's no cure right now, but they're still working on it. One day they might do. But the hydroxyurea, it slows down a lot of the crisis. It's never no cure, but one day they might have one.
Okay, just final thoughts. Anything you want to say? Let people know. Any advice? That's
no, like I said, education.
Okay.
End of that.
That's it.